Hello, everybody. Welcome back to Monday Night Mythbusters. Tonight, we are not on a Monday night. We're on a Wednesday, and we have a very special guest tonight because we are wanting to speak about diabetes and the big impact diabetes has on our population and our health in general. So we have tonight Dr. Brian Mowll, who is the founder and medical director of Sweet Life Diabetes Health Centers. He also serves clients worldwide as a diabetes coach, and he's a master licensed diabetes educator and one of the first doctors to become certified with the Institute of Functional Medicine. So we want to welcome tonight Dr. Brian Mowll. Thank you so much for coming.
Yes, happy to be here. Thank you for inviting me and excited to do this tonight.
Absolutely. I'm excited too. I'm hyped. You're my first interview on my Facebook Live page. So thank you very much for agreeing to do this.
Starting at the bottom and you'll work your way up, I guess.
Not at all. Not at all. No, I know Leslie has, Leslie Harrington here, my wonderful health coach, has spoken with you before because she does a lot of diabetes education. And so Absolutely. I know you guys have had a relationship and you guys are really kind of pushing that paradigm, really moving things forward so that patients understand how important it is to identify if they have pre-diabetes, certainly if they're diabetic, and then to do the actions that they can do to create health and reverse or at least manage their diabetes and pre-diabetes.
Well, it's so needed, isn't it? I mean, diabetes is exploding all over the world, and it's sad, really, and especially when you consider that there's so much we can do to not only prevent, but make a huge impact on the lives of the people that do already have type 2 diabetes.
Right. And knowing that by 2020, at least 10% of the population, if not more, will be diabetic, and many of them don't even know it. And then probably 10 times that is going to be pre-diabetic. Those numbers are pretty astounding.
Yeah. Not only in the lives of people, but the drain on our healthcare system. You know, hundreds of billions of dollars spent on diabetes every year to just manage it. And obviously that's not even a cure. So this isn't going away anytime soon, unfortunately.
No, absolutely not. And it really impacts not only the people with it, but all of their families, because that takes away a breadwinner. That makes, excuse me, somebody that has to go to the hospital or worry about which job they're going to take because they have to have insurance. So it really impacts globally. And it's not just confined to those people that actually have it.
So true. Yeah, it has a massive impact. And one thing I always like to just be real clear about when I'm doing a Facebook Live like I am with you guys is that it's not just type 2 diabetes. Pre-diabetes, as you mentioned, is, at least 5 to 10 times what we're seeing with type 2 diabetes. Many people aren't even aware that they have blood sugar problems. The latest numbers is somewhere around 84 to 85 million people with pre-diabetes and metabolic syndrome, which is high blood sugar plus overweight and high lipids and blood pressure. So when you lump these conditions together, it's really almost half of our entire population. And so that's largely what we're going to be talking about today. You don't have to have diabetes to get value out of this conversation, that's for sure.
No, absolutely not. And I think one of the things that's most striking to me is that Alzheimer's is now being considered type 3 diabetes. And I know this year has been really big in terms of brain health, but I haven't heard that many people really talking about the importance of blood sugar control to their long-term cognitive ability. And so I think this is really important, and I love that you've got a speaker in your upcoming Diabetes Summit, Dr. Masley, that's going to be covering that. I think that's awesome because we really need to look globally at all of the impacts of this disease.
I totally agree, and we've had Dr. David Perlmutter on in the past as well discussing that topic. And there are many connections between not only blood sugar, but the underlying root cause of type 2 diabetes, which is insulin resistance, which results in something called hyperinsulinemia, which is having elevated levels of insulin in the bloodstream, and the connection between those and all forms of dementia, not just Alzheimer's. Alzheimer's is the leading type of obviously cognitive impairment and brain disease, number 7 killer in our country right now. But we also have to look at vascular dementia, Lewy body dementia, and other forms. And these are all affected by blood sugar, some more than others. And again, the underlying root cause, which I wanted to bring up because you don't have to have high blood sugar, it turns out, to develop brain problems from insulin resistance. So insulin resistance, which is what happens in prediabetes, even pre-diabetes, we get this elevation of insulin, we get this inflammatory process, this systemic inflammatory process that's chronic, and that's one of the leading factors or contributors to brain disease, including the formations of these amyloid plaques, which are seen with Alzheimer's disease.
Right. Yeah. Tell us a bit more. So, what symptoms would people want to look out for with that? What things can we be doing?
Yeah. So I don't certainly like to wait for symptoms. I mean, if you're waiting for symptoms of dementia, then, by the time you get those, it's almost too late. I mean, you've gone way, way, way down that path. If you wait for signs of diabetes, excessive urination, excessive thirst, dehydration, dizziness, and these types of things, your blood sugar is probably over 300. So we don't want to wait for these symptoms. We want to actually check, and that's where I think functional medicine and a good screening and a good consultation comes in, because we want to check for these much earlier in the process. So we look for things like insulin. Well, we actually test insulin levels, but you can look at just most people have had, for example, a standard lipid panel, and most people have had a metabolic panel, which includes glucose. There's another test that if you have a family history of diabetes or concerns about diabetes, called the hemoglobin A1C test, which you should have done as well. And you can look at those three and get a sense for where your blood sugar is. Normal blood sugar is a range is about 76 to 92. Usually right in the mid 80s is kind of the sweet spot, no pun intended there, but right around 83 to 85 is where you want it. And if it's starting to climb up into the mid 90s, close to 100 or over 100 on a fasting serum blood glucose test, then you should already start to be concerned. You're already starting to lose tolerance for glucose. You're becoming glucose intolerant, moving into prediabetes. The hemoglobin A1C test I mentioned, the acceptable range for that, even with someone with diabetes, goes all the way up to 7, which is way too high. Normal A1C is between 4.5 and 5.5. Now, some people may have no idea what I'm talking about. I've never had that test done. But again, if you have a family history of diabetes, or this is a concern, or you're starting to see elevations in blood sugar, you need to have a hemoglobin A1C test done. I know you probably run these on every single one of your patients, or many of them. And we want to see it in that optimal range of about 4.5 to 5.5. Right. And then lastly, I mentioned real quick on the standard lipid panel, I don't worry so much about total cholesterol. We look at LDL a little bit, but the main number there for insulin resistance and metabolic issues is the triglycerides. And then there's some ratios that we can look at also. But we want those triglycerides not just under 150, which is the normal lab reference range, but under 100 or even closer to like that 50 to 70 range. I see in my clients that are on good low-carb diets, who are actively working on improving their metabolism, burning fat effectively, their triglyceride levels will be down under 70. And so that tells me that that person is metabolically healthy. Good blood sugar, good low triglycerides, good normal A1C reading. And if any of those are out of balance, those are warning signs. I was going to say early warning signs, but not even early. Those are warning signs that you really need to start paying closer attention to things.
Absolutely. And I run those types of panels on everybody that comes through, even if they aren't overweight or they don't have a family history, because I found a lot of people have, unknowns to themselves, elevated blood sugars, elevated insulins, and sometimes elevated A1Cs. And the insulin can be a nice little warning signal that something's going on even before your sugar increases or your A1C increases. So, yeah.
So a lot of people don't realize, sorry to jump in there, but a lot of people don't realize that elevated insulin can cause significant damage to the body, even sometimes as much or more so than elevated blood sugar. So we think of diabetes and all these complications from hyperglycemia, from too much sugar, glucose in the blood, which is true. This is a major factor. Hyperglycemia creates more what's called glycation, and glycation of proteins in the brain is one of the factors that leads to dementia. In the lining on our blood vessels can lead to inflammation in the blood vessels, which can lead to atherosclerosis and coronary or cerebral vascular disease, kidney problems, things that lead to amputation, and you name it. But it's not just the hyperglycemia. The hyperinsulinemia, too much insulin in the blood, is, some researchers say, as damaging or even more damaging because it causes the storage of fat, and it seems to cause the storage of fat around our organs, which creates this vicious cycle. We become more insulin resistant. We carry this inflammatory, angry fat around our organs, which then also contributes to cardiovascular disease and other problems. And that all that insulin acts on our kidneys as well, causes us to retain fluid, drives our blood pressure up, which of course is a major risk factor for heart disease and stroke as well. So we've got to be careful, not just with the high blood sugar, but also with the high insulin.
Correct. Yeah, and what's interesting, I hear from people all the time, like when you're going in a traditional conventional setting, they're getting these tests and they're immediately ruling themselves out from even the potential of prediabetes because their doctor just says, oh, I had my blood test and everything's fine. Mm-hmm. And so they're constantly telling, and so much of it is the awareness and not kind of immediately eliminating yourself from the prospect of being pre-diabetic. Because if you go to the AHA, American Heart Association, the ADA, the American Diabetes Association, those risk factors don't tell a story. So you can very well have a lot of risk factors or, in your numbers that have nothing to do with some of those, predispositions. It's not all genetic, we know, and the way that society is and our food is today and the way that we're exposed to the toxins and things. There's so many other moving parts that contribute to this that people are just so unaware of. So my big thing is kind of helping them understand why it's so important to know your numbers, have these pre-tests, know what an A1C is. They're not testing for insulin like they should be in the conventional setting. So even though they're getting this insurance covered, every quarterly testing, like they think it's more proactive than a lot of people out there, they might not be getting the proper feedback. Get those tests from your doctors, look at them, have someone else review them, see where you're really at,
Yeah, that's a great comment and great advice. And I like the way you said there's so many moving parts, because there really are especially with type 2 diabetes and prediabetes and metabolic syndrome. A lot of people don't realize how many things can affect our blood sugar. And, diabetes is treated conventionally. We just really treat the sign of high blood sugar by suppressing it with medications. And unfortunately, that does nothing to address all those moving parts, those underlying root causes of what's driving the blood sugar up in the first place. And so we have to look at all those things. And again, that's where functional medicine comes in. So you do a good workup on someone, and you're looking at their lifestyle, their diet, their activity level, their gut health, their dental history, their presence of chronic infections, how are their hormones, their testosterone, estrogen, progesterone, thyroid, adrenal hormones. And we have to, it sounds crazy and complex, but all of these things can affect our blood sugar and our insulin glucose balance.
Absolutely, yes. Speak a little bit, if you would, about the effect of stress on sugar and the management thereof of prediabetes, for example.
Yeah, I think that's an important factor. And when we describe stress, we describe it as three categories of stress. So there's of course, most people are aware of psychological stressors, but we want to go well beyond that. So for me, there's these three categories. There's the daily life stressors, which a lot of those are sort of psychosocial stressors, things like responsibilities and kids and our job and, our bills and all these things. These are important factors to look at, and they trickle down on us, filling our stress bucket every single day. So we do need to pay attention to those. But then we also have these major life events. So if you go online and just Google, major life events, stress chart, you're going to see things like a death of a loved one, a divorce or separation, moving, personal illness, job loss or job change. And these I found can stick with people for a long time sometimes. It's not just the event, but how we cope with that event. So, you might have been divorced or lost a spouse or a child 10 years ago, and that can still be driving stress into your system on a continual basis. So a lot of people don't think about those things, and it's important to do that. And then the third category, which I think is actually the biggest, is physiological stressors. And that's where we have to look at chronic inflammation, gut dysbiosis, hormone imbalances, chronic pain, and other musculoskeletal dysfunctions, chronic infections, anything that can drive stress into the HPA axis, the adrenal system, if you will, that will elicit a cortisol or adrenaline response, which then raises our blood sugar. Anything that does that is a stress to the body. And sometimes those stresses are eustresses or good stress, like certain types of exercise, and sometimes they're distresses, negative stresses. But if it's a stress, it can elicit an adrenal response and raise your blood sugar. So we've got to be aware of all that. And there is a very clear connection. For example, there's a drug which well called prednisone, which is a steroid drug. It's synthetic cortisol, the same hormone that the adrenal glands release when we're under stress. And prednisone is known to significantly raise blood sugar. So people who are on prednisone, their blood sugar shoots up. In fact, we've had cases of prednisone-induced diabetes for people who have autoimmune diseases that have long-term use of prednisone. But this is what happens every time we're under one of these stressors, is our body releases this stress hormone, and both cortisol and adrenaline raise our blood sugar through the liver. And that's something that most people completely ignore. They don't realize that those things are a big part of the picture when they're trying to manage and control their blood sugar.
Yep. Yeah, and compounded with sleep, that sleeping a whole nother topic, but the amount of insulin resistance that results from poor sleep, even in just one night of poor sleep, the overall long-term effect of people, I think, just they kind of tuck it in with nutrition and fitness. And I see a lot of people in the fitness industry, or in my group of people that have high blood sugar and they're fit as a fiddle and they eat pretty well, but they're not considering so many of these other factors. So when you look at a statistic, like we have 1 in 3 come by 2050, which is probably grossly underestimated if you base it on historical predictions, that's not just going to be your typical high-risk candidate. Those are going to be all of these people we're talking about that are falling into these metabolic chaos type of situations, or they're just chronically stressing their body.
Yeah, and as I'm going through that list, the people who are listening here right now are probably saying, yeah, that's me, that's me, that's me, that's me. And so now you can see why half the population has prediabetes, because this is such a big deal.
Big deal. And then it's compounded because that stress piece increases your cortisol, and that makes you gain weight, which makes it harder for you to manage or balance your blood sugar.
Interrupts thyroid hormone function. Can block the activation of T3, increase reverse T3, which is a whole nother avenue of affecting our metabolic health. But when our thyroid activity isn't happening the way it's supposed to, it short circuits our metabolic system. We're not burning fuel like we're supposed to. And if we're not burning our glucose and we're not burning our fat, then we're going to accumulate more, and that's what happens.
Yeah. Well, this is all great information, and I know that you're hosting this, the upcoming Diabetes Summit. I believe it starts April 23rd. And so if anybody's interested in this, and I think everybody really, it behooves them to be interested in this, check out Dr. Mowll's Diabetes Summit. There's a great list of speakers. Can you tell us about a few of your speakers?
Yeah, so, we've been talking already for 30 minutes almost, and, it's like we're barely scratching the surface. So you can see why it's so important to, bring in 32 or more experts. And this is our 5th year doing it. So we never run out of things to talk about when it comes to diabetes and blood sugar. But we've got Jill Carnahan, who you probably know from the IFM, works with Robert Roundtree out in Colorado. Kellyanne Petrucci talking all about bone broth. We have some experts in low carb. We have experts talking about ketogenic diet. We've got some people talking about plant-based diet. So we cover the spectrum there because I don't think there's necessarily a one-size-fits-all, although I do have, my ideas about what works best for most people, and you'll hear that come through as I interview some of these guests. But we have Brad Pilon, who wrote the book Eat, Stop, Eat, all about intermittent fasting, and he's got a bit of a unique approach to intermittent fasting. And many, many others. There's Razi Berry, Ben Lynch talking all about methylation and some genetic factors related to diabetes. Jack Wolfson, the paleocardiologist, is on, and you mentioned Stephen Masley earlier talking about brain health. Dr. Alan Christensen, Dr. Tom O'Brien talking about gut health and autoimmune disease. Dr. Isabella Wentz, the thyroid diabetes connection. So we've got a lot of incredible experts on the summit, and they each bring their own, topic really, but they're all related to blood sugar and metabolic health. So, weight, that includes weight loss, improving blood pressure, improving blood sugar, and again, improving metabolic health and preventing or even making a huge impact on type 2 diabetes.
Awesome. I'm definitely going to be going and watching as many as I can. And then you can also, I think, purchase the package too, which is great if you don't have time to sit down and listen as the days go through. So I didn't mention it. I'm sorry, but to jump in again, but it is all online. Some people say, "Where is the event? Where is the event?" It's all online, so you can sit in your living room and watch. It's over 7 days. You mentioned it starts on April 23rd. So each day there's 4 or 5 different presentations. They're all free to watch. But you've got your 4 on one day, and then the next day you have 4 other ones, and the ones from yesterday go away. So you want to really look at the schedule, decide which ones you definitely don't want to miss. Make sure you put those in your schedule and you catch those throughout the week. And as you just mentioned, if you really love it and you just want to own the whole package, there's you can buy it for a nominal fee, certainly compared to what it costs to put it all together. Oh, absolutely.
Yeah. I think I own all the historical packages. They're just the value and what you get, not just from the interviews, but the supplemental information that you provide is just invaluable.
Yeah. Thank you, guys.
Absolutely.
Yeah. Thank you for what you're doing.
Yes. Thank you very much. Appreciate our time together, and looking forward to all the interviews that you've done for this summit. And
Brian, do you want to tell them where they can find you if they want to look for more information on what you do?
Sure. Well, what the best thing is just to follow the link that you guys put, hopefully right below this video. There'll be a link. They click on that and go to the, go check out the event. And from there, they're going to get plenty of me over the course of that entire week. And we'll follow up from there. But I think that's the main thing. Go check out the summit. It's great information, and we try to make it barrier free. So, go check it out and learn as much as you can.
Absolutely. Yeah, sounds great. So check out the link just below here. It should be there. And if not, there's also some links on my webpage on CarolynGeorgeMD.com. And so there should be easy to find. You can Google the Diabetes Summit. There's many ways to get there, but looking forward to seeing everybody there.
Yes. Awesome.
Dr. George Leslie, thank you for having us on. This was a lot of fun.
Thank you very much.
Have a good night. Yeah, have a good night now.
Bye.
Okay, we're ending. Okay, do it again.